Hi friends, this is Dr. Rajeshwari Reddy. I am a senior gynecologist from Hyderabad. So today we will be talking about diet and food habits in pregnancy. When we talk about diet or food habits in pregnancy, women have a huge library of information. Advices and opinions pour in from all corners, be it family, friends, internet, or even people you meet randomly at a flight or a train or even in a function. So, all pregnant women are advised to have a balanced diet. A balanced diet includes mainly 5 groups of foods, which are carbohydrates, proteins, fats, vitamins, and trace elements. These foods should be taken in the right proportion to fulfill the calorie requirement and the nutritional requirement of a mother and a child. First, let's see the calorie requirement of a pregnant woman. In the first trimester, there are no extra calories that are required. In the second trimester, the mother needs around say 340 to 350 calories extra. Not more than that, and not even double as people say in a twin pregnancy. In third trimester, about 400 to 450 extra calories are required. In addition, at any trimester, at any point of time, a mother needs 100 calories more if it's a twin pregnancy. In lactation, a mother is required to take 250 to 300 calories more per day. The logic of eating for two people definitely is not true. During pregnancy, we mainly talk about iron, calcium, folic acid, vitamins, and protein supplements along with the diet that we take. So first let us talk about folic acid, which is very important in first trimester. In fact, it is a key supplement to be started before conceiving. That is, when you are still planning for pregnancy, 3 months ahead of planning, you must start folic acid. It reduces the risk of neural tube defects, defects of the brain and spinal cord. Foods that are rich in folic acid are bread, flour, rice, cereals, etc. One must start taking 5 milligram of folic acid every day. There is no particular time that is required. It can be taken at any time of the day. In the first trimester, due to nausea and vomiting, morning sickness, we won't have much choice of eating. Usually, people lose around 2 to 3 kgs of weight in the first trimester. So, there's no question of eating more or putting on weight in the first trimester. So, one has to be very patient up to 12 weeks of gestation. In the second trimester, we start supplementation with iron, calcium, vitamins and protein powder. Let's start with calcium. In any form, one should have 1 gram of calcium per day. Usually, we give 500 milligram of calcium as a tablet, and the rest we try to compensate by advising dairy products like milk, yogurt, cheese, which are rich sources of calcium. Other sources include green leafy vegetable, beans, peas, nuts, and seeds. Yogurt, in addition to being a good source of calcium, is also a good probiotic and helps to maintain the digestive flora, which betters the digestive system. Vitamin D. It is important for calcium absorption. It enhances immune function and brain health. Sunlight is a natural source of vitamin D. 15 to 30 minutes of exposure to sun, where there is direct exposure of skin, is very good for vitamin D. Our aim is to have 2000 international units of vitamin D per day. Sources of vitamin D include egg yolk, milk, tuna, salmon fish, cereals, soya milk and tofu. Next comes iron. Iron supplementation is important to maintain the hemoglobin levels for the well-being of both the mother and the optimum growth of the baby. We aim for 45 milligrams of iron per day from food and supplements. We give iron tablet to be taken every day night after dinner. And we ask the mothers to eat green leafy vegetables, beetroot, figs, dates, jaggery, beans and pomegranate, which are very good source of iron. especially for vegetarians. Animal products include red meat, fish and eggs. Absorption of iron increases if it is supplemented with folic acid and vitamin C. Iron deficiency leads to generalized weakness, aches and pains, infections, muscle cramps, easy fatigue, tiredness, loss of appetite, breathlessness, and also it causes growth retardation of the baby, leading to low birth weight. Next comes proteins. It is essential for the healthy growth of the baby tissues and organs, especially the brain of the baby. It also helps mother to build the uterine tissue and the breast tissue to support the growing baby and lactation. Legumes, lentils, peas, beans, peanuts, paneer, fish, eggs, chicken, lean beef, and also dry fruits like almond, walnut, hazelnut, pumpkin seed, flax seed, sunflower seeds. These are all very rich source of protein, and of course soya is also a very good source of protein. And coincidentally, these foods are also very rich in vitamin B12. A well-balanced protein diet helps to maintain optimum sugar levels all through the day so that you feel energetic all day. It curbs hunger and excessive craving, especially sugar craving. The requirement for protein is about 60 grams per day, which approximately accounts to around 20 to 25% of the total calorie intake. Another question most commonly asked is about caffeine. So coffee, which is consumed in moderate amounts, like say just 1 cup of coffee once or twice a day, is absolutely fine. Now coming to the fruits. 1 or 2 servings of fruits per day, preferably fresh seasonal fruits, whatever is available in that season is good. And you must include citrus fruits like orange, kiwi, grapes, which are rich in vitamin C, and also high fiber fruits like banana, watermelon, which helps in the bowel movement and relieves of constipation, which is very common in pregnancy. And 1 fist of dry fruits is also good enough. But we need not eat all the things on all days, so we could settle for a certain amount of foods on a particular day. Like say you can have 2 bowls of fruits today, and tomorrow probably you can skip 1 bowl and replace it with a fist of dry fruits. So that's how we need to manage the diet. You need not eat everything in one go on the same day. Now coming to the foods that you have to avoid in pregnancy, preferably go for fresh cooked food. So don't go for frozen food, raw milk, raw meat, unwashed fruits, and cold cuts, cheese, alcohol, smoking. All these are not really good in pregnancy. And don't indulge in fast foods, deep fried foods, very spicy foods, and make sure the hygiene levels are maintained at all times whenever you eat, whether it is at home or outside. Always wash hands before eating. Luckily for us, a typical Indian diet is a very well-balanced diet. Our 3 main meals and 2 small meals is ideal for a pregnant women. A glass of milk or fruit at about say 7 to 8 a.m. in the morning, and then proper breakfast at 9 a.m. Then a glass of buttermilk or coconut water at around 11 a.m. Lunch at around 1 p.m. A small snack or a bowl of fruits or a fist of nut around 4 p.m. And of course it can be accompanied by a small cup of coffee or a tea. Then an early dinner at around 7 p.m. And it's always advisable to have dinner before sunset so that the digestion is easy and you have a good sleep. And if one feels hungry, then it is advisable to have warm milk before bed because it calms the mind and it also calms the body. Always use iodized salt for cooking to help maintain the thyroid levels. If you see a typical Indian thali, it contains the right amount of carbohydrates, as in 2 rotis, a little bit of rice, vegetables, and dals for protein. So you always have 1 cup of dal. Then there's also 1 spoon of ghee, which is a very healthy fat. And then there's 1 cup of curd for calcium. And there's always 1 fruit or a small dessert post meal, which is actually an ideal thing to do. So actually, if you follow the Indian diet, there's nothing much that you need to actually specially put attention on. We are all on a naturally well balanced diet. I tell all my patients that food has to be well chewed and relished as one eats. Enjoy the aroma of the food, the flavor of the food. Try to stick to homemade food. And while eating, don't watch television, don't meddle with the food. Put your mind on what you're eating so that it gets well digested. You enjoy the food you eat. It is well said, as we are as good as we eat. So eat well. For a healthy mother and a healthy baby, food is very, very important. Thank you.